with the month of Shaban and go into Ramadan and start fasting and see how things go. We don't like this medication, metformin, although we use it a lot, but there's a condition which I'm not going to go into that. When people are getting very dehydrated, this medication can go and affect the kidneys, and then it may not be the best thing. So, and then these are some of the drugs, and I don't want to get into the nitty-gritty of this because, this presentation is not meant to be a, sort of an official advice because everyone is different. One size will not fit all, right? So somebody's diabetes will be different than others. But I just thought I'll throw some of these medications out there to help sort of delineate this, in the... Okay, so fasting for people who are on insulin. Again, these medications, I'm not gonna, but I've already emailed the slides as well. But this is some guidelines where, we can cut back on the insulin a little bit. The gist of this slide is, we can cut back on the insulin a little bit. So this way, even if they were to fast, then the sugars don't go low. I always tell my residents, my students, and Dr. Sami will agree with me as well, that low sugar kills you within 3 to 5 minutes, but the high sugar never usually kills, especially in the US, right? But the low sugar, you can sleep through it and you don't wake up in the morning. That's very, very tricky. So when people are taking insulin, they get some insulin, they go to sleep, never wake up for suhoor. So that's why it's very important to talk to your doctor, have a good plan before you go into Ramadan, and not just get excited because, obviously, as I said, Allah does not want any hardship on us. Our health comes first. Okay, so monitoring for insulin-dependent diabetes, so you can easily check your finger stick, that blood glucose, all hour, Maraji have actually allowed that we are okay, because if you feel like your sugar is getting low or something, check it. If it's low, you can break the fast, if it's less than 70, because, obviously we don't want to die. Terminate the fast below 60, but usually less than 70 is hypoglycemia. We can do it. Or if the sugar goes above 400 or 500, yes, you can go ahead and break the fast. Try not to exercise too much before iftar or even, sehri as well, because, this way you're going to be consuming less, burning more, and the higher chances of going hypoglycemic, which is low sugar. And of course, drinking plenty of water can help with some of the sugar getting peed out in the urine as well. So some questions, fasting in pregnancy, we talked about this. I'm going to talk more about this as well. It's okay to fast during pregnancy, but Quran actually talks about it's okay. You are, yes, you're exempted. If you want to, that's fine. I'm going to talk about this in a little bit. But if you do not fast, you can always make up for it. So pregnant females don't have to fast. Fasting and nursing is the same thing. If it's absolutely necessary to feed the baby, and then otherwise, the mother is going to take a toll on the health of the mother, then they can skip the fasting as well. Blood draw during fasting is allowed. Medications during fasting. So tablets, we try not to take it, but inhalers, Dr. Sami, right? Because it goes into the lungs.
The religious sort of verdict for that is nothing should go below your throat. So technically speaking, inhalers are going in the lung, but I would have to clarify it with a religious authority on that, whether inhalers are okay or not.
Yeah, no, I just spoke with the sheikh at MCC.
Then you have it.
So that's why, I put these slides over there. He said that patches are allowed. He quoted Ayatollah Sistani, so.
Some will make the case of smoking as well.
That's true, that's true. So let's not go there. That's true. Injections, if the injections, right, exactly. If the injections are to give you energy and stuff, then not allowed. But it depends on case to case as well, right? So, but then again, this is a debatable topic, as Dr. Sami said. So we're not going to go into that. So pregnancy and fasting, all pregnant women have the option not to fast. So that's good. Many do decide to participate as they feel guilty. But what we found in the studies that 70 to 90% of pregnant women observe the fast without any problems. If they want to, that's fine. And there was no negative effect on the baby or the mother. But if they don't want to, then they're absolutely exempted, and they can make up for it for the next year or whenever they are done with, pregnancy. Some studies in healthy pregnant women without diabetes have shown no harmful effect of fasting on baby or mother. Okay, but they're allowed not to fast. Many do fast, and no harmful effects. Healthy options for iftar. Well, we just saw some healthy options over here as well. The chola was good, the chana, right? All of that, dahi bada, all of this is completely fine. The gist of this slide is just so that, we can introduce more vegetables, more fruits, because they give you less acid. So that way, it's easier to fast longer, because 30 days is not easy, right? But I'm just saying, people are working, they have so many things. In America especially, you have to take care of 1,000 things, right? So 30 days, yes, becomes challenging at the end of the day, I'm not going to lie. So, but if we take care of ourselves better with less oil, and even if we were to use oil, maybe something, which is easier on the stomach, like olive oil or avocado oil these days, right, Dr. Sami? Those might be easier. So, like a good option for suhoor would be, some yogurt or some lassi, right, with some dates, because that's the sunnah for Prophet Muhammad. Peace be on Durud padhne par Muhammad wa ale Muhammad. Allahumma salli ala Muhammad wa ale Muhammad. So the Prophet obviously would fast, with dates, and then he was also, open with dates as well. So dates is a very, very, very rich resource of nutrients, especially rich in, potassium, other electrolytes as well, good vitamins A and C and everything. So, and that gives you a lot of sugar as well. So 2-3 dates, glass of lassi, you're done. Believe it or not, I've tried it, and when I do eat a paratha, I'm miserable throughout the day. But when I try a little bit date, even some glass of milk, I'm easy, because it's a slow release energy, which these dates give you, and they keep giving you energy throughout the day. So that's sort of a good option as well. We can do, other fruits or whatever, you want to do for iftar as well. But the gist of this is, where you don't feel heavy, you can continue with some weight loss as well throughout Ramadan instead of gaining weight, and lots of water during seher as well as iftar. Now the water content, if you look at American Medical Association and other, kidney foundations as well, and National Kidney Foundation and other, they suggest that, in an adult male, about 64 ounces of water every day. So this big bottle of water is about 16.9 ounce. The regular bottle, not this one. This was only 4 ounces. So the big one is about 16.9 ounce, right? So 4 of those would be good. But what I've seen is, obviously you get more dehydrated because you're working throughout the day. In Ramadan, it's best that if you shoot for about 80 ounces. But unless somebody has heart failure, and that's a different story, we're not going to go into that, or kidney failure. But generally speaking, 30 ounces in the morning. And so if you do drink a lot of water in the morning, and then if you just eat a date or two, then you don't have a lot of room for anything else, right? So you'll be done. The same thing goes with iftar as well. Break your fast, eat whatever you like, that's fine, healthy. But then give yourself these 2-3 hours before you go to bed that keep drinking water. So spicy foods can cause heartburn, fried foods, indigestion, we talked about that. Sugary treats, they can also cause a lot of sugar spikes as well, plus make you gain weight as well, store belly fat, and may not work out fine, so please don't overeat as well. As soon as that's the sunnah of the Prophet as well, as soon as we start feeling that, we're full, we should stop. So use veggies, lentils, halim would be a good option, for the part of the world where we are from. Dal is a great option. You can use brown rice as well. That's fine, you can use some rice, it's okay. You can have carbs. It's not that, you should not. It's just that, less carbs and maybe a little bit more protein would help you sustain better for the iftar. Chicken and fish rather than beef, right? And things like that. Choose fruits instead of juices, because juices are very artificial. This is just sugar. It's not going to help, right? Apple, berries. Berries are actually very good. Some of the best fruits. Allah has given all these fruits with multiple, nutrients in them. But berries are especially rich in antioxidants and anti-inflammatory. Dr. Sami would agree, hopefully. So drinks lots of water during suhoor and iftar. So food for thought. Fasting is for me, and I, Allah, only will reward it. Hadith Qudsi. While fasting, if one does not give up falsehood in words and actions, then Allah has no need of him giving up food and water, saying of Prophet Muhammad. So, I tell my nurse all the time, because she comes and tells me about, oh, she did this, she did that, she did this. So I tell her, what, I will not listen to this, because fasting for me, hopefully, and for all of us, it's not only so that, we can stay away from food, but it's also purifying your soul, which means, see no evil, speak no evil, and hear no evil. Assalamu alaikum. Please, yes.
So I know me, and I know the youth especially, we like to go to the gym and get our gains in.
Sure.
And especially during Ramazan, we have to adjust our schedule. We try to go before before iftar. And then, I know you said this, we shouldn't work out too much, and then we try to go in the nights, and our parents are like, oh, you guys are out late tonight. So, but and from a health standpoint, what is the best time to get a good workout or go to the gym?
Yeah, that's a great question. So we don't recommend, overkilling yourself during the month of Ramadan, because mashallah, you're young, you can do it, I cannot do it. But it's just right before iftar, where that would be a perfect. Maybe 20 minutes, 30 minutes of less vigorous exercise compared to what you've been doing pre-Ramadan, right? So pre-Ramadan, I mean, if you're working on the morning, you're working like, out, long hours and, spending more time in the gym, which is all good. But over here, you can do light weights. The best exercise would be walking. But right, you don't want to do it at suhoor, because if you do it suhoor, obviously you're going to be completely exhausted, dehydrated. And usually a lot of people would ask me this where, when I give this presentation somewhere else as well, they were saying, well, no, it's best that, we go ahead and do it in suhoor. It's absolutely not recommended. You can do it 4, 5, 6 days. You're going to find yourself completely miserable. This month is more spent in sort of reciting your munajat, connecting with Allah, reading Quran, rather than, it's okay, obviously it's about depriving ourselves from food and water, but as we just talked about this, Allah does not want this, unless we don't give us the falsehood and everything. So I think, if you connect with Allah more spiritually, spend more time in that, you can get your workout maybe 20, 30 minutes, just pre-iftar, I think that would be the best thing, so. But that was an excellent question. Yeah, but don't kill yourself, during Ramadan. Certainly not late in the night, yes, Dr. Sami says, right, absolutely. Yes.
I think it's more for Dr. Sami, since this is area of expertise.
No, Dr. Sami.
I mean, whoever can answer.
Sami, you can come over here.
Yeah, Sami, why don't you go over there and please? That'll be great. So the question is more related to, you talked about type 1 diabetes. First of all, for people like me who are completely illiterate in this area, can you tell us the difference between type 1, 2, 3, 4, 10, whatever it is, right? And secondly, you said type 1, they shouldn't fast. And if you're talking about type 2, 3, and the other type of diabetes, is it okay for them to fast? So maybe you can answer.
Yes, Dr. Sami. Go ahead.
So the main difference between the type 1 and the type 2 diabetes is body's production and its utilization of insulin. So as most of us know, that insulin is a hormone that helps in uptake and intake and processing of glucose, sugars in our body. No matter what we eat, everything comes down and breaks down into sugar for our body to utilize it as a source of energy. So type 1 diabetics are folks whose pancreas, which is an organ in your abdomen, is not producing any insulin. So the body is completely dependent on exogenous, outside insulin in order for it to process the sugars. In type 2 diabetes, the pancreas is producing insulin, but the receptors are resistant to the proper function of insulin. So that's the main difference between type 1 and type 2. And as Arbab mentioned in his slides, one of the things that I think prompted Sarim to ask the question, workout, the best time for workout, as Arbab said perfectly, that the best time to work out is before you do the iftar. And one part in the slide that said that do not work out before iftar was meant for people with type 2 diabetes who are fasting.
Correct.
Okay. So again, fasting, as physicians, Arbab will have, so many people will come and ask that, can I fast or can I not fast? So there are certain things that absolutely a person should not fast. Type 1 diabetes is one of them, because your blood sugars are fluctuating so much that your body is essentially not able to control them. And in that case, you are more prone to have low blood sugars, which can easily kill a person within a very short amount of time. In type 2 diabetes, if a person's diabetes is fairly well controlled, then they can play with their medications a little bit and then can fast. But again, at the end of the day, fasting is such an intimate affair that is totally between a person and Allah. If I am not feeling well for no matter what reason, and I know I cannot fast, then I know I cannot fast. And again, if I am able to fast, then no matter what reason I try to put up for myself, I will know inside me, within myself, in my heart, that hey, I'm okay to fast. In that scenario, there is no reason for me not to fast. So I think that answers your question.
Very, very well said, Dr. Sami.
There are other types of diabetes. There is a diabetes insipidus, which is a different type of diabetes that has to do with your kidneys processing of fluids. And then there are other subtypes, but the more common that we see in general life in our society are type 2 diabetics.
Thank you, Sami. Thank you so much. Very well explained. Thank you.
Dr. Arbab, for our Muslim brothers over
Yeah.
It's good for iftar, good for sahur.
Yeah. Of course. Yeah, no.
Sorry.
I'm so sorry. I should have been more precise over here. So welcome. Thank you so much for being here. We appreciate you. Thank you.
There's some young brothers over there.
Yes. Thank you so much for being here. Thank you. So so the month of Ramadan, I'm no, scholar, but the month of Ramadan is about 29, 30 months according to the lunar calendar, where, we see moon sighting, we start the month, and then, we don't go with the other calendar. So it's about 29, 30 days roughly. And, we wake up, before, around the dusk time, where we are, before the sunrise, right? So we are, not forced, but it's more agreeable and more acceptable for us to eat. That's called suhoor, where we should eat. The Prophet Muhammad actually, he practiced that, so we practice that. If you don't, for some odd reason, if you cannot get up in the morning or whatever, or if you don't feel like, eating, then you don't. But it's recommended that you eat something. That's called suhoor. That's sunrise, just right before sunrise. And then at sunset, you saw that, we had a little feast over here. Then we break the fast. We try not. That's called iftar, where after sunset, we do that. We abstain from everything, as we talked about. Food, any ill talk, having negative thoughts in our body. We try to abstain from all of that. Plus, also we abstain from food and water as well for those 30 days. In order to, as we talked about, for me, it's more of a spiritual cleansing, and for all of us, it's meant to be that way. Although, it's the more hunger, it's not about being hungry. It's more about, what you're going to do for, the one actually who has given you all of this, right? So we try to clarify our mistakes. We try to purify our soul by not eating and drinking and giving up for this month of 1 month. So the suhoor is, right before we start the fast, and iftar is, when we end the fast, But again, I'm no scholar, so correct me, Zia bhai.
You're right.
Thank you. Thank you so much. Yes, Zia bhai.
As I heard, and I think I read somewhere too, that especially type 2 diabetes, it is reversible. So is that true, or just a kind of fake statement or something? And the other thing is that I have heard about it, that the type 2 diabetes or any diabetes, it is just due to some kind of parasites which are basically affecting your pancreas, and which is taking you towards these diseases.
These diseases.
So, Ramadan, could it help us to make ourselves to work on reversing the diabetes?
Thank you so much, Zia bhai. Excellent question. First question which Zia bhai asked was whether type 2 diabetes is reversible. Sami will agree with me that, the way Sami explained it very well. So type 2 diabetes is more where the insulin may be released from the pancreas, but it's a problem with the utilization of that insulin and the cells, because a lot of these cells have fat on them, So that's why, if you see the phenotype, which means, if you look at the person, right, Sami? With more type 2 diabetes, they're more on the, other side, on the obese side, but type 1, they're going to be very thin because, urine output has been so high and they're not able to keep the intake, where they get very dehydrated, so they start losing weight, what we call as ketosis. So in type 2 diabetes, if we do a lot of exercise, right, and if we eat the right thing and we cut down on the carbs, yes, a lot of my patients have reversed type 2 diabetes. I had a patient, obviously without naming anyone, I saw a while back at Emory, and she underwent gastric bypass surgery, right? Because of obesity. She lost about 150 pounds of weight, and she went from 11 medications to 2 medications. And her A1C went from like 14, 15 to 4.5. So that's your answer, so it can happen. And anytime, the sugar goes up in type 2 diabetes, I would recommend them, just go, obviously drink lots of water, take your medicines, and go and take a stroll, take a walk for 20 minutes, So what it does is, these cells, these receptors, they open up, and the insulin goes inside from the blood, and they take up into the muscles and everything. So yes, it gets hard, but a lot of weight loss, exercise, eating the right thing can reverse. The second question which Ziabai asked, whether it's a parasite or some, it's usually not. It can, some of this type 1 has been hypothesized that it could happen from a viral infection or something in some people, but usually, we don't know that. But usually the parasites, the answer is no. Right, Sami? Right, thank you. So, but thank you so much, Zia bhai. Thank you. Jazakallah. Yes, please, Wasi bhai.
Assalamu alaikum. Thank you very
Walaikum
much.
assalam.
First of all, giving us a presentation is
Thank you
pretty
so much.
useful. Not for
Appreciate
only it's pretty useful for every one of us. So
Appreciate
thank you very much. And
Thank you
I
so
just want to ask you to recite a salawat for the efforts that you're putting in.
Allahumma salli ala
Muhammad
Muhammad
wa
wa
ali
ali Muhammad.
Muhammad.
Jazakallah.
Thank you.
So much. Thank
I'm not sure if this question would be related to the topic, but again, I take medication for hypothyroidism, right? And I'm pretty sure that there might be a few other folks too that have thyroid, and especially the question related to sahur time, right? I know we woke up early in the morning compared to the regular timing, so I'm not sure how much time earlier it would be beneficial for us to take the medication. Generally, for regular days, I took around an hour probably, but I'm not sure, because sometimes you're short of time, running out of time, and we think about eating food too. But again, I'm not sure, sometimes we do justifiable giving a time for that medication. So I'm not, just want to have a question too.
That's a great question, brother. You asked me. Sorry, what's your name, sir?
My name is Hassan.
Hassan. Thank you so much, Hassan, for asking this question. And then, and Sami is here as well. He's more of an expert on this. But thyroid medicine, what we take is, the levothyroxine, probably Synthroid. What you take is, typically you want to take it at least 30 minutes, because if you take it with food, it's not going to get absorbed. So your TSH levels are going to keep going up. So when you look at the test, a lot of these people come to me, they're like, well, I've been taking my medicine. How come, I swear I've been taking my medicine? No, I know, I swear as well, you've been taking the medicine, but you've been taking it the wrong way. So the way to take this hypothyroid, right, Sami, is to at least half hour to 45 minutes before. 30 minutes is okay. But for your point, 1 month is not going to mess it up too much. It takes about 4 to 6 weeks for these thyroid hormones to kind of go out of whack or get back in shape and whatever. So 30 minutes is absolutely okay. So you might want to be careful. So say, what is the time these days? 5:42, 4:41, whatever. 30 minutes before that, if you get up, you take it, or just put an alarm, take it, go to bed, and then wake up again at Fajr, and then, well, not Fajr, but the Insak, eat something, and then, but yes, you will have to do 30 minutes. What do you think, Sami?
You can also reverse it. You can take it at the
You can take it at bedtime as well, yes.
break the fast with a glass of water and take your medicine and then wait for 30 minutes to eat something.
Yes.
Set a timer, 2 or 3 hours before you actually wake up for Sahri. You can take it at that time. You'll have 2 or 3 hours. Your sleep will be interrupted, but I've found that the best way is to take it at iftar time. Given that you are disciplined enough not to eat for that 30 minutes.
I told you, he's more of an expert on this, so yes, so that's the right thing to do. Yes, that's a great question.
Thank you.
Great, yeah. There are very few medicines, which have to be taken completely 30, 40 minutes prior. Sami, levothyroxine, anything else? That's pretty much it, right? Yeah, that's it, right? Yeah. So, yes, what's your
My question is,
Yes.
if you take a medicine, if you're diabetic, and you take a medicine in the morning and in the evening, what is the good timing in iftar time, in the Ramazan? What is the good timing to take medicine?
That's a great question, So it depends, because a lot of these medicines are long-acting, short-acting. If your sugar does not go down during fasting, and if you feel okay, go ahead and take it, just as suhoor. And then you have your iftar, and then go ahead and take it right away. It's okay, as you eat. I would take it, as soon as you open it, have your medicines with you, and go ahead and take it. Right, Sami? Rather than waiting for 1 hour, 2 hour, 3 hour. So go ahead and take it, and then keep eating. Have your medicines with you. That's the right thing to do. So.
What I've been doing, I was just taking in the morning time only,
Okay.
not just skipping in the night time.
No, it's okay. It depends. I don't know your history.
Sorry, other
Yeah.
way around. Taking in the night time
Yeah, that's fine as well.
and
Yeah,
skipping in the morning
Yeah.
time. So,
That is safe.
yeah, that is very safe.
Morning time,
Yes.
you're going to be hungry all day.
right, so it's better, right? Yeah.
So if you take medicine in the morning time and you have not eaten for 12 hours, the risk of
Yeah.
sugars dropping down is much higher.
So it's better taking the okay.
Yeah. And, and you're going to be fasting as well, so your A1C will come down anyways, hopefully, inshallah. So. No, it's going to be, inshallah, less than 5. Yes, please.
Is fasting safe for patients who are on GLP-1 and Ozempic and drugs like
That's
that?
a great question, right, Sami? You want to take this? Yes.
Yeah, so these are the new medications which are used as an injection once a week. They inhibit a person's appetite. So, and then they are in your system for, it's available in the pill form as well. So maybe the pill form would be a little bit safer to take versus the injection form. I am not aware of, on top of my head, that the pharmacokinetics, which is how they're processed metabolically. I'm trying to think. It's a really, really interesting and good question. As long as you're doing sahur, and iftar okay, and your sugars are controlled, it should be okay. That's the short answer.
And the GLP-1s, they're taking, some of you will agree with me, like once a week, right? So many a times, you can, if you just decrease the dose, right, Sami? So instead of taking, like, say, Mounjaro comes in 2.5, 5, 7.5, 10, 12.5, and 15, right? So say, for example, if somebody is on Mounjaro, maybe if they're taking 5, maybe go down to 2.5 for the month of Ramadan, right? Semaglutide comes in 0.25, 0.5, 0.75, 1, and 2, right, milligrams. So if you're doing semaglutide, which is Ozempic, you can, if you're on 0.5, go down to 0.25. That's what I'm saying, Because the way he said, this GLP-1 is going to decrease your appetite anyways, and the chances of hypoglycemia could, I don't know, potentially go up. So maybe reduce the dose and, and then do it. But it should be okay. Yeah. Yes.
How do you navigate like ibuprofen, Advil, for pains in the middle of the day?
There's no navigation through that, because if you're in pain, then, as I said, Allah does not want us to, this is not a hardship for us, right? This is just to, cleanse your soul and everything. And obviously it's mandatory for all Muslim men and women, depending on, if you're not sick. So if you're in pain, if you think you cannot tolerate this pain, then I guess, then you'll have to break the fast, right? Yeah. So the other way to do this is, that, a lot of people are chronic pain medications, right? Maybe they take it in the morning time, right? And then to the point that, some of these are long-acting, 12 hours. And then, hopefully they're not in pain until like the fasting breaking. And then, once you're done with the fasting, you can take your other medicine. But if they're on a short-acting like ibuprofen, Aleve, Advil, Motrin, Naproxen, all of these, Mobic, Meloxicam, so many out there, Celebrex, then a lot of these are short-acting other than Celebrex and stuff. So if you're going to take, like say if you have a bad toothache or something, if you take it 4, 5, 6 hours, the effect is going to go away. So it might be tricky, So yeah. And if you're asking me that, can we take a medicine during Ramadan, that basically means that you if you take it, then your fast is null and void. Yeah, it won't be. Yeah. So, thank you. Excellent question. Thank you. Thank you so much, Sami. Thank you. Wasi bhai, Zia bhai, thank you so much. Jazakallah. Thank you so much. Jazakallah. Yes. I just learned from Sami, but I appreciate it. Thank you so much. Sami, thank you. Thank you. Thank you so much. Allahumma salli ala Muhammad wa ali Muhammad.
Excellent presentation.